My name is Sagar. I'm a TAC student. I'm here for my interview from you guys. Let's start from brief history. What is your full name, and also where are you from, and do you still live in Houston?
Okay, my name is Lê Nguyen Nguyen, and originally my family from Vietnam, and yes, I live in Houston pretty much all my life.
Okay. And what is your employment background, and where do you work now, and how long you have been working here?
Well, I have been employed with Walgreens, and I've been working with them for the past 12 years. And yes, I still work for them right now.
What is your current title, and also how long have you held this title, like as education-wise, and also as a pharmacist?
Yes, my title is a registered pharmacist, and I've been working in this field for about 12 years now.
Okay. I see. Okay, so when you started, what were your primary duties and responsibilities? Have you changed? Have they changed whether with time, or has it been the same?
Okay. Well, my main responsibility as a staff pharmacist, retail pharmacy, is basically dispense drug, make sure it's correct and the right dose for the patient, and the duties pretty much stay the same. Not much change.
Okay, let's go a little personal now. Did you ever, in your early life, knew like what we're gonna do, or is that like you decided while you were in school?
No, not really. I don't really know what to do exactly from start. Pretty much the first one in my family go to college, pretty much. So you just learn and pick up your interests as you go along. So my interest in pharmacy pretty much come later in life with going to school to friend and learning different subjects and stuff.
Okay. Did a teacher, neighbor, family member was a role model for your achievement, or was that someone else that actually influenced you?
Yeah, it was my high school teacher pretty much in chemistry and biology and stuff that got me interested in science.
Okay.
And that's where I'm going with for pharmacy.
Okay, briefly describe your formal education. Like what degrees do you have? What degrees do you hold right now?
Okay. I have to do pre-pharmacy pretty much for about 3 years.
Okay. And
completed a pharmacy school for another 4 years. So a total of 7 years to be a pharmacist.
Okay. Was the communication curriculum was required? Any speech class that you had to take?
Yes. Speech class was part of the requirement for the pre-pharmacy classes. Okay. So everybody had to do that.
Okay. Do you plan on continuing education after this pharmacy degree?
Not at this point right now. Just working right now.
Okay. Let's see. What do you like most about your job, and why do you? What is the least thing that you like about your job?
Well, what I like about my job is to help our sick patient get them well. That's the main part. And this likely will probably have to do with the business part of the pharmacy. Okay.
In what situations are communications pitfall or challenges most likely to occur?
Communication problem would be probably the language barrier between different culture and different nationality.
Okay. What are your communication strengths and weaknesses?
Well, the communication strength is I can verbally try to make other people understand me pretty well, and I can understand pretty well or read their opinion. And weakness is most likely, again, probably is the different nationality and barrier in culture, background, stuff like that. So it's hard to communicate with different people.
Have you had any cultural competency training to assist you while we were working, as treatment preferences, or anything else, like anything else which helps you along with this?
No, you don't have any specific training to help you with that, but my company, Walgreens, does have a program where a system where you can actually call and get an interpreter for different languages, like Spanish, Vietnamese, or Russian, or whatever. You can call them up and get some help, and there's an interpreter for that.
What are the challenges of effectively communicating with patients or other healthcare professionals from a different cultural background?
Like again, language barrier, different cultural beliefs, interests, and again, basically just cultural overall is a barrier for different people.
Okay. Also, how do you handle language barriers? Do you use an interpreter or are you learning a second language?
Yes, try to use an interpreter for language barrier.
Ricardo Line 1.
Are brochures, pamphlets, or any other materials provided in another language that helps you along with your communication skills?
Yes, in fact, we do have that. All different languages which can be translated into instruction or direction on the bottle of the medication, and pamphlet also written in different languages. So yes.
Does gender play a role in how you communicate with others and the people communicate with you while you're on your job?
No, we are pharmacists, so we are professional working. So gender doesn't affect how we communicate with other people communicate with us.
Okay. Also, what role do nonverbal communications play, such as some gestures, and how did you learn to interpret nonverbal communication cues?
Well, that's learn to read people non-verbally,
Okay.
body language, gestures, whatever. You can just as you can go. The more you work in the field, the more you know to recognize different signs. That people come with pain, you can see in the face, you know, or the body language tell you there's a problem. Then you pretty much read off of that.
Okay. And also, do you have any final thoughts or advice to give me for this skills and this pharmacy program?
Yeah, I mean, like, if you're interested in the pharmacy field, you can pretty much do what you're doing right now by following the pre-pharmacy course. Take your admission test, have an interview, and then try to complete your 4 year, and then you'll be ready for the license and get ready to work as a pharmacist.
All right. Thanks a lot, Mr. Louis. Nice seeing you.
No problem.
All right. Excellent.